systolic or diastolic, harsh or blowing. Let's master the four most common heart murmurs in just 1 minute. First up, the systolic murmurs. These happen when the heart is squeezing. If you hear a harsh crescendo-decrescendo murmur at the right upper sternal border that radiates to the carotids, think aortic stenosis. It's like a stiff door that's hard to push open. Now, if you hear a blowing, hollow systolic murmur at the apex that radiates to the axilla, that's mitral regurgitation. Imagine a leaky valve letting blood flow backward with every beat. So, for systolic murmurs, remember aortic stenosis is harsh and radiates up, while mitral regurgitation is blowing and radiates to the side. Next, the diastolic murmurs. These occur when the heart is relaxing and filling. Hear a soft, blowing decrescendo murmur along the left sternal border. That's aortic regurgitation, where blood leaks back into the ventricle. And if you hear a low-pitched rumble with an opening snap at the apex, you found mitral stenosis, a stiff mitral valve that struggles to open. So, there you have it. Aortic stenosis, mitral regurgitation, aortic regurgitation, and mitral stenosis, the 4 key murmurs simplified. Keep grinding.